Hello everyone, my name is Stephanie Angel B. Paris and today I'm going to discuss the common skin infections with their cause, symptoms, treatment, and prevention. So first, let me define what is skin. Skin is the body's largest organ made of water, protein, fats, and minerals. Our skin protects our body from germs and regulates body temperature. Nerves in the skin help us feel sensation like hot and cold. With regards in our skin, if the parasites, fungi, or germs such as bacteria penetrate the skin and spread, the skin infection might occur. So what is skin infection? It states here that skin infection is a condition where bacteria or other germs enter the skin through a wound and spread, causing pain, swelling, and discoloration. Your skin is your body's largest organ. It has many different functions, including covering and protecting your body. It helps keep germs out, but sometimes the germ can cause a skin infection. This often happens when there is a break, cut, or wound on your skin. It can also happen when your immune system is weakened because of another disease or a medical treatment. And also, some skin infections cover a small area on the top of your skin, and other infections can go deep into your skin or spread to a larger area. So there are common examples of skin infection. The first one is the impetigo. It is a common and highly contagious skin infection that mainly affects infants and young children. It usually appears as reddish sores on the face, especially around the nose, mouth, hands, and feet. Over about a week, the sores burst and develop honey-colored crust. Remember that the highest risk of impetigo if we have a diabetes, undergoing dialysis, and sunburns. So, impetigo have causes. Impetigo is an infection caused by strains of staph or strep bacteria. This bacteria can get into your body through a break in the skin from a cut, scratch, insect bite, or rash. Then they can invade and colonize. And also the condition can be contagious. You can catch this bacteria if you touch the source of a person with impetigo or you touch items like towels, clothes, or sheets that the person used. However, these bacteria are also common in our environment, and most people who come in contact with them won't necessarily develop impetigo. Some people normally carry staph bacteria on the inside of their nose. They may get infected if the bacteria spreads to their skin. So we need to remember the impetigo symptoms. The first signs of impetigo are reddish sores on the skin, often clustered around the nose and lips. These sores quickly grow into blisters, O's and brust, and then form a yellowish crust. The cluster of blister may expand to cover more of the skin, and sometimes the red spots just develop a yellowish crust without any blisters being seen. And for further, the sores can be itchy and occasionally painful. After the crust fades, they form red marks that fade without leaving scars. Infants sometimes have a less common type of impetigo, with larger blisters around the diaper area or in skin folds. These fluid-filled blisters soon burst, leaving a scaly rim called a collarate. An impetigo can be uncomfortable. Occasionally, it may involve swelling glands in the area of the outbreak or a fever. So let's proceed of its treatment. Antibiotics are effective against impetigo. Which type of antibiotic you get depends on how widespread or severe the blisters are. If you have impetigo in only a small area of your skin, topical antibiotics are the preferred treatment. Options include mupirocin cream or ointment in the ritapomelin ointment. If your impetigo is severe or widespread, your doctor can prescribe oral antibiotics such as amoxicillin or clavulanate. Certain cephalosporins, or clindamycin. These drugs may work more quickly than topical antibiotics, but they aren't necessarily better at clearing the infection. And oral antibiotics can also cause more side effects than topical antibiotics, such as nausea. The best ways to prevent infection are to stay clean and healthy. Other tips to avoid impetigo include keep hands clean, wash hands regularly, or use alcohol-based sanitizer if you don't have soap and water. And practice good hygiene. Clip your fingernails regularly to avoid scratching. Sneeze into a tissue and then throw the tissue away. Bath daily or as often as possible, especially for children with eczema or sensitive skin. And for further, avoid scratching. Don't scratch cuts or wounds. If your child gets a cut, scratch, or wound, keep them from scratching it. And cleaned wounds. Clean cuts, scrapes, and injuries with soap and water. Then put an antibiotic cream or ointment on the wound. And also keep linens clean. Wash underwear, towels, and sheets that in hot water. Another skin infection is the folliculitis. It is a common skin condition that often caused by an infected or inflamed hair follicle. It can look similar to acne and be uncomfortable or itchy. Folliculitis often has a psychosocial impact because of its appearance. There are many different types of folliculitis, each one unique based on the cause, the infectious organism, and its impact on the skin. Folliculitis can happen as a result of daily activities like shaving, getting in a hot tub, and excess sweating from exercise or outdoor work. You can have folliculitis anywhere on the body that has hair, and common places include your face, arms, upper back, and lower legs. Anyone can develop this kind of skin infection, but certain factors make you more susceptible to the condition, including having acne or dermatitis. In general, folliculitis is caused when a hair follicle is inflamed or swollen, and infected. This causes the follicle to swell under the skin, creating uncomfortable bumps on the surface of your skin. For many of the specific types of folliculitis, the cause isn't always known. However, there are certain factors that can increase your risk of developing folliculitis. A few risks can include if you shave often, if you have been using an oral antibiotic for a long period of time, and if you are overweight or obese, and if you have a history of diabetes, and if you do activities that make you sweat a lot and don't fully clean off afterwards, and if you spend time in a hot tub or sauna that isn't properly cleaned. And its symptoms is, in most cases, the main symptom of folliculitis is red bumps that look like pimples on your skin. This could also look like they're white-filled bumps, or they could be filled with pus. And folliculitis can help itchy and uncomfortable. Many people feel the need to scratch when they have folliculitis. It's best to try and not scratch at the spots because you don't want to open them up. This could possibly cause a worse infection of the hair follicle. And fortunately, it have a treatment. Treatment options for folliculitis depend on the type of folliculitis you have and the severity. Certain types may need more aggressive types of care, while others may go away with little to no treatment. If your folliculitis is mild, it can sometimes be treated at home. There are several ways you can care of your irritated skin, including using antibacterial cleanser to clean the skin. This will limit the amount of bacteria on your skin, and applying warm towels to your irritated skin to soothe the discomfort, and for further using anti-itch creams. And you can try to prevent folliculitis from coming back with these tips. Avoid tight clothes. It helps to reduce friction between your skin and clothing. And dry out your rubber gloves within uses. If you wear rubber gloves regularly, after each use, turn them inside out, rinse with soap and water, and dry thoroughly. Avoid shaving if possible. For men with razor bumps, growing a beard may be a good option if you don't need a clean-shaven face. And also shave with care. If you shave, adopt habits such as the following to help control symptoms by reducing the closeness of the shave and the risk of damaging your skin. Shaving less frequently, washing your skin with warm water and antibacterial soap before shaving. Using a washcloth or cleansing pad in a gentle circular motion to raise embedded hairs before shaving. Applying a good amount of shaving lotion before shaving. And another skin infection is the cellulitis. It is a common infection of the skin and the soft tissues underneath. It happens when a bacteria enter a break in the skin and spread. The result is infection which may cause swelling, redness, pain, or warmth. In cellulitis, you are at risk if you have trauma to the skin, diabetes, and circulatory problems such as not enough blood flow to your arms and legs. Things that cause cellulitis include injuries that tear the skin, infection after surgery, long-term skin conditions such as eczema or psoriasis, and foreign objects in the skin. Bone infection underneath the skin. An example is a long-standing open wound that is deep enough to expose the bone to a bacteria. And the symptoms is it can appear on almost any part of the body. It usually show up on damaged skin such as inflamed wounds, dirty cuts, and areas with poor circulation. It needs to be treated by a doctor. Common symptoms include redness, red streaks, swelling, warmth, pain or tenderness, and leaking of yellow, clear fluid or pus. And its treatment is to care for cellulitis. You should rest the area, elevate the area to a swelling and discomfort. Use over-the-counter pain relievers like acetaminophen or ibuprofen to ease the pain, as well as keep your fever down. And let's proceed to the prevention. Common sense and good wound care are the best ways to prevent bacterial skin infections, including cellulitis. Clean all minor injuries that break the skin with soap and water. Clean all minor cuts and injuries that break the skin like blisters and scrapes with soap and water, and that is so very important. And that would be all. Thank you for listening, and God bless.